My name is Sarah Sipek, and I'm an associate editor with Workforce Magazine. I'm joined today by Dr. Ricardo Martinez, who is the chief medical officer at the management consulting firm North Highland. Thank you so much for joining us today.
My pleasure. Thank you.
So actually, you have some interesting data for us. We're going to talk a little bit today about the growing Hispanic population and how that's impacting healthcare. So some good numbers came out today.
Yeah, there's a lot of information coming out now, but what we're concerned about is we're just beginning to wake up to what retail and marketing and entertainment and beverages and everybody else has been doing, and that's focusing on the Hispanic consumer and now the Hispanic patient as an opportunity. And so what you're seeing is very interesting numbers. You're seeing that in the next, probably by 2020, there'll be 1 in 5 people will be Hispanic. That in the last 5 years, you've seen a 50% growth in their spend. There, as a GDP, the U.S. Hispanic population is in the top 15 GDPs in the world. That's an interesting point, isn't it? They're very loyal, and so they're really an untapped consumer that you can go after, but healthcare doesn't have great relationships with them. They don't really trust a lot of institutions, and so you have to reach out to them. And so we see them as a huge opportunity. We've been spending a lot of time looking at ways to be successful in that.
So what are some of those ways? If you want to, obviously, you have to start somewhere, so where is that point?
Well, you have to know your consumer, right? You have to know your customer. So they're very, very focused on family. So family is very involved in the decision making. There are some, they're very strongly connected to the community. So you have to reach out of that hospital into the community, into where they make their decisions and where they get their information. And you have to build relationships, because relationships are very important for them, because trust has to be built, right? And if you build the trust, then what you get is that they come to you. They have a lot of unmet need. And so you don't want patients showing up sicker. You want to engage them early when they're healthier, and also identify any risk factors. And then make sure you have resources that go in the community, like community health workers that are culturally competent, people who represent them, people that help build that trust, and also can help them navigate the healthcare system, which, quite frankly, even as a physician, that's kind of tough to do. So if you can help do that. And secondly, is when they do come to the hospital or their services, you should have culturally competent experiences for them. So not just someone who interprets, but understanding what their needs are. I've seen organizations that have an interpreter will call in by phone, but I've seen ones where they have the food and the icons, and they have the types of rooms that allow more family members to be in, and they have a workforce that is bilingual may be the right one, but they actually can extend across the culture, and they can make people feel comfortable there and want to come back. They feel like they've been cared for, which is a big part of the trust factor for healthcare. And then the last thing is having those long-standing, long-term relationships that build retention and the downstream revenues. Remember, this is a fast-growing group. They are younger, but they also live longer, so there's a lifetime value there that you want to be part of, and everybody wins.
Excellent. Well, that is great information. Thank you so much for making it relevant to our audience. And thank you so much for your time being here today.
Thank you very much. Appreciate it.
Thanks to everyone watching. Have a good day.